Hello. Good afternoon, all the second year students. Now today we will see the new topic, chemotherapy of. Yesterday you can see it, protozoal. Now today you see the chemotherapy of parasitic disease. Parasitic disease. So chemotherapy of parasitic disease. Generally you can call the anthelmintics. क्या बोलते हैं उसको? Anthelmintics. The drug are used that kill the parasites or vermicide or expel from the body. Now generally is called as the anthelmintics. क्या बोलते हैं उसको? Anthelmintics. The anthelmintics are drug. Anthelmintics are the drug that either kill the parasites, is called as vermicidal. क्या बोलते हैं उसको? Vermicide. And that drug are paralyze the intestinal helminths and expel them out with the feces. ये feces के साथ बाहर निकले मॉर्निंग में. is called as vermifuge. Now see, the anthelmintics are that kill the parasite or helminths. They kill the helminths, that is called the worms. क्या बोलते हैं उसको? Worms. Body में worms, so many type of the worms it should present. Tapeworm, roundworm, this should be present in the body. Hook's worm, threadworm, weave's worm, flukes, these are present. And that worms, so many type of the worms, they kill or paralyze and exhale them out from the body. That's called the vermifuge. And they kill, that is called as the vermicides. The most of the worms live in the GIT. Most of the worms live in the GIT, gastrointestinal, but some worms live in tissues. और कुछ वर्म्स है वो टिश्यू में भी प्रेजेंट रहते हैं. Now the common worms and drug use their treatment. Now you can make a, now these are most important, make two columns, write down here worms and drug use or choice of the drug. Now the first tapeworms. Now there are three types: beef tapeworm, pork tapeworms, fish tapeworm. This should be the tapeworm. Generally see the tapeworms is known as cystodes. The drug are used for the worms are nicotinamide. Second, paracetamol. Now another, a first tapeworm, second roundworm. Nematodes, roundworm, Ascaris, lumbricoids. Example of drug commonly used for the drug is most choice use mebendazole, albendazole, parenteral palmoate, piperazine citrate, piperazine citrate, thiopentazole. Now see, roundworm, mebendazole, albendazole, parenteral moate, piperazine citrate, thiopentazoles. Now for the roundworm, these are the choice of the drug and drug use for the roundworms. Most commonly used albendazole, mebendazole are the use of the drug. Hookworms. Third, hookworm and cyclostorms, duodenals. Example choice of the drug are used for that: mebendazole, parenteral palmoate, albendazole. Albendazole is the most common drug used for the so many type of the worms. Commonly these are used. Roundworm, it should be present in your GID. Okay, now the next worm, threadworm. ये hookworm, hook जैसा रहता है. Round worms, the worm should be in the rounded like that. Worm should be is having the rounded. ये ऐसा. Hookworms like a hook. The hookworms. Fourth is the threadworm, like a thread. Next, thread worm. Threadworm. The drug are used for mebendazole, albendazole, and these all. Choice of drug: parenteral palmoate, mebendazole, and albendazole. Okay. Interior BS vermicularis, name of the, and the next should be the weepworms. The weepworms are the drug are used all these three drug, remaining three weeps, mebendazole, albendazole, parenteral palmoate, and last flux. Schistoma species. The drug are used parasicontal, metrafonate, myridazole, okay, and the last filariasis. Drug are used ivermectin. Now you can use in the corona ivermectin doxycycline in the combination. You can take the ivermectin doxycycline azithromycin. The drug is filariasis and diethyl carbamazine. These are the choice of the drugs are used in the worms. Okay. The mebendazole. Now these are the worms. See the again. Tapeworms use nicosamide, parasicontal, roundworm, mebendazole, albendazole, parenteral palmoate, piperazepine citrate, thiobendazole. Hookworms, mebendazole, parenteral palmoate, albendazole. Threadworm, parenteral palmoate, mebendazole, albendazole. Weepworm, mebendazole, parenteral palmoate, and flux. The drugs is a different drug here used parasicontal, metrafonate, and niridazole, and filariasis ivermectin. Then now you can use in the corona treatment. In the corona ivermectin is given doctor. Diethyl carbendazole, ivermectin, doxycycline, vitamins. These drugs are given initially prevention of the corona. Take the after 40 days. The one drug is there ivermectin. Okay, these are in the filariasis. Now the commonly used albendazole and mebendazole. The Mebex mebendazole is marketed name is Mebex. Sometime vermine. These are the marketed prescription name. Mebendazole is a broad spectrum anthelmintics. In the broad spectrum anthelmintics. Mebendazole is the broad spectrum antibiotic. It is poorly absorbed if administered in orally, hence they having the few side effects. But commonly it is given in the orally. They kill the parasites, or they kill completely parasite which expelled from the GIT. It is effective against, it should be effective against roundworms, threadworms, weaveworms and hookworms. Most commonly used, it is sometimes it is effective against the flukes and tapeworms. That's why the mebendazole are used. The drugs are remarkably safe. Mebendazole is a remarkably safe. Having the side adverse effect is abdominal pain. They cause abdominal pain and diarrhea. There is a, and then it is contraindicated. Don't use in such a condition. Contraindicated in pregnancy. Pregnancy may it is not given. They are contraindicated. Dose 100 mg. Twice a day for 3 days. Yes, sometimes you can use 500 mg. Tablet and oral suspension is available. Okay. And the albendazole, it is a congeners of the mebendazole is the broad spectrum antibiotic. It is used the roundworm, tapeworm and the threadworms. It is effective. Treatment is given for the 3 day for the tapeworms, and the dose is 400 mg. Is a albendazole का dose है. Albendazole dose is 400 mg. Okay, it is used roundworm, threadworm and the tapeworms, and it is also contraindicated in the pregnancy. Contraindicated in pregnancy. Okay, thank you.